So if you see the first question, topical atropine is contraindicated in. So they want to know that where you cannot give the atropine. So one is malignant glaucoma, second corneal ulcer, third is acute congestive glaucoma, and fourth is acute anterior uveitis. Now, as I always say, that there are two ways of doing a question. First is the direct one, and second is by eliminating. So I will tell you how to do both. One is your direct method. So let me tell you the answer. The answer is actually the acute congestive glaucoma. This is the direct answer. Why? Because you know that in the acute congestive glaucoma, it is this mid dilatation of the pupil which brings the attack. Of acute congestive glaucoma. We all know that it is the mid dilatation of the pupil, and obviously in the predisposed individuals, they will bring the attack of acute congestive glaucoma. Now, what are the predisposed individuals? That is another important thing. So we know the risk factors. What are the risk factors of the acute congestive glaucoma, right? So I'll try that. Meanwhile, we are discussing a PYQ, we are discussing the options, we will try to do all the other important aspects of this question, how this question can be reformed, what are the other things that you need to know related to this question. Okay, so what are the risk factors of acute congestive glaucoma, right? So start writing the risk factors. Number one, obviously hereditary. So we can have the hereditary predisposition for the acute congestive glaucoma. Then it is more common in females, especially more than 50 years of age, and all those who have the shallow anterior chamber. For example, there can be hypermetropes. We can have the hypermetropes. Those people who are having the hypermetropia, they also have a high risk. Why? Because they also have a shallow anterior chamber. Then you must be remembering that I always tell you one very important thing, and that is the type A personality. So these people also have a risk of lot of diseases, not only the acute congestive glaucoma, the diabetes, hypertension, thyrotoxicosis, peptic ulcers, CSR. We have so many things. Okay. So what are these people who have three things in common? Hurry, then we have worry, and third is a curry. Hurry, worry, and curry. So all those people who are always in worry, always in hurry, and taking a lot of curry. So these are type A people, and they have more risk. Now, what are the other characteristics of hypermetropes? So you can get small eyeball, we can get small eyes, we can get small corneas, and then we can have the shallow anterior chamber. So any person who is having the risk factors and he goes into the mid dilatation of the pupil, he is suffering from acute congestive glaucoma attack. So obviously you are not going to give the atropine in these people. Now let us try to see the other things. Number one is malignant glaucoma. Now if you see the malignant glaucoma is also called as, what are the other names? The malignant glaucoma is also called as ciliary block glaucoma, or it is also called as the inverse glaucoma. This is also called as the inverse glaucoma. So because this malignant glaucoma or the ciliary block glaucoma is often treated by mydriatics and cycloplegics as a treatment of choice, because what is most important? You have to open the ciliolenticular block. What is this block? Due to the misdirection of the, it occurs due to the misdirection of the ciliary processes. This is occurring due to the misdirection of the ciliary processes, and they are turned backwards. Due to this backward tilting of the ciliary processes, the aqueous humor is also going backwards. It is accumulating in the vitreous cavity. So what we have to do, we have to open this block, ciliolenticular block, that is opened by the mydriatics and cycloplegics. So obviously it is not contraindicated, it's a drug of choice rather. Corneal ulcers. In the corneal ulcers, we are using the mydriatics and cycloplegics as the adjuvants. So this is again a very important point also, and many times this has been asked as a PYQ that mydriatics and cycloplegics are used in the corneal ulcers for? So this is for the giving the pain relief, because whenever we have corneal ulcers, we have some amount of acute anterior uveitis, we have some amount of iridocyclitis, and you know what is the treatment of choice of acute anterior uveitis, which is given as a separate option also, that is the mydriatics and cycloplegics only. So whenever we have corneal ulcer who is having the associated acute anterior uveitis, there also we will give mydriatics and cycloplegics. So both by direct as well as by elimination, you come to know that the answer will be acute congestive glaucoma. All right.